Good afternoon, everyone. This is Bambina Olivares, the Director of Programming for Manila House, and your moderator for today. Welcome to our online conversation entitled The Kids Are Not All Right, The Impact of COVID-19 on Kids and Teens, in partnership with Centre Medical International, your premier outpatient medical clinic. If this is your first time to join us online, allow me to introduce Manila House. We are a private members club that opened in February 2017 with the aim of bringing together an assemblage of people from the business, creative, cultural, and intellectual communities who are drawn to each other by a shared interest to continuously learn about art, culture, food, business, and politics, as well as health and wellness from the diversity of the fellow members themselves. It is a community of curious, committed, and caring individuals, and it lives on beyond the physical confines of the club. We began our webinar series in May 2020, covering and encouraging discussion about a range of topical issues, from business and investment to health and wellness, and art and culture. We have featured both local and international speakers and continue to broaden our reach among members and non-members alike. Our previous webinars are available for viewing on the Manila House YouTube channel. That said, for the non-members among us, you might like to consider membership to Manila House. We have a limited number of memberships still available. Please email us at membership@manilahouseinc.com for more information. Now, let me turn to today's discussion. The COVID pandemic has taken a toll on all of us, especially on the physical and mental health of teens and kids. Getting the virus is one thing, while getting locked up at home is another. How do we take care of them when they are sick? How can we better approach and communicate with our children? What activities and exercises can we do with them to boost their overall health? CMI's Pediatric Emergency Medicine Specialist will discuss today the impact of the COVID-19 pandemic on kids and teens and what parents and teachers can do to help them cope in the new normal. Our floor will be open for Q&A after the speaker concludes her discussion. For questions, kindly send them through the Q&A box below. You may also stream this webinar through our YouTube channel after the session. Also, please note that this webinar is being recorded for uploading to YouTube, as mentioned, and is being streamed on the Manila House Facebook page, fb.com/Manila House Inc. So, let me introduce to you our speaker for today, Dr. Olivia Camille Reyes. Dr. Olivia Camille Reyes is a practicing pediatric emergency specialist at the Centre Medical International, or CMI, in Bonifacio Global City. She is also currently a consultant of the Department of Pediatrics at the Philippine General Hospital. She finished her medical degree at the University of the Philippines and underwent clinical clerkship at the University of the Philippines, as well as the Weill Cornell School of Medicine in Manhattan. She also underwent observership for neonatology at the Radboud University Medical Center in the Netherlands. She's a diplomat of the Philippine Pediatric Society, and she's also certified instructor for pediatric advanced life support and in advanced life trauma support. So without further ado, let's give the floor to Dr. Reyes, CMI's Pediatric Emergency Medicine Specialist. Good afternoon, Dr. Reyes. Thank you for joining us today.
Good afternoon, and it's nice to be here. And for this afternoon, I know a lot has already been said about COVID-19 and the disease and how it manifests in adults, given the devastating experiences that we've had and the deaths that we've had so far. But today we're going to focus on children and how the disease has impacted their lives as well. So it does not mean that if the physical effects are actually a little less or a little unnoticeable in the child population, that they did not suffer during this time as well. So this is our outline for this afternoon. We will begin to talk about child physical and mental health. And we will go on to talk about the world we live in and how child wellness was before the pandemic. So was it okay that way back then before everything started? We'll then go on to the meat of the matter and talk about COVID-19 and how it has impacted the children that we have. And moving forward, we'll now talk about what we can do at this point in time to be able to live with COVID in our midst. So let's talk about child physical and mental health. When we talk about health and the exact definition of health as we practitioners follow it, the definition of health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So what this means is that the practice of medicine or the practice of health does not only pertain to treating organic disease, but also seeks to maintain and promote health and wellness in the mind. We talk about mental health. The definition now broadens into the emotional and psychological factors that allows us as individuals, whether we're adults or children, to be able to move freely in the world and to be able to connect with each other, to form meaningful relationships with the world around us. In children, however, we cannot talk about mental health without talking about development, because it is a period of constant change. So this is a period wherein there's a sequence of different changes that happens within our physical, language, thought, and emotional milieu that prepares the child from the beginning of childhood up to adulthood. So when we talk about mental health and childhood, bringing those two concepts together, we talk about mental wellness that is very much linked with development, to be able to reach developmental milestones and learning healthy social skills to cope with the challenges that each child will encounter in this world. So let's see how the world was before the pandemic. So I remember everything around me that time was so fast-paced. There were so many things that we had to attend to and so many things moving around, and the pace was just really chaotic. And for that particular time, we also saw a lot of dependence with technology, as we still do now. But during the time, we also see that even though the internet and the technology that we have, our mobile phones, were connecting us to each other, there are also some disconnection in the sense of physical contact and actual physical connection. In terms of feeding and diet, we see that there was a lot of consumption of unhealthy saturated food, high calorie food around us, and being privy to TV and Netflix and all those other on-demand entertainment platforms, there has been a shift from having very large interests outside of the home with physical activity, and now turning on to a more sedentary lifestyle. On the flip side, there's also the problem of poverty and calamity, as well as the victims of war. So children have also been subjected to these very difficult situations before the pandemic. And so what did we see as an effect of that particular world milieu? We saw that metabolic and lifestyle disease were on the rise at that time already. So we would see hypertension and diabetes, things that we would usually see in adults, now we see in the children. Children, on the flip side again, on the at-risk environments subjected to poverty, calamity, and war, would also present with malnutrition, with some lack of access to healthcare services. So in terms of healthcare supervision, monitoring, and routine vaccination, these were not accessible to these at-risk children. So in terms of developmental disabilities, we saw in the Global Burden of Disease study that was published in 2016 that the prevalence remained the same in that year. However, from 1990 up to 2016, we saw that there was actually no improvement, which meant that while the disease was not of a high burden, was not increasing in burden, the services that to actually support the disease or developmental disabilities were not really improving. There were increased prevalence of developmental disorders all around the world. And globally, when we talk about mental health issues in children, up to 20% of children are estimated to be affected by mental health problems. And when we talk about mental health problems, it's not just mental health disorders. This also includes forms of psychological distress, which you cannot actually diagnose as a psychiatric entity, but on the flip side, also pertains to the child having difficulty in navigating social relationships and challenges as they grow up into adulthood. Locally, we saw mental disorders ranking third as a leading cause of disability-adjusted life years in children. And we also see the stress and trauma brought about by child abuse, and this cuts across all socioeconomic classes, whether it's high, middle class, or low. Child abuse and physical abuse, whether it's at home or at school. There's also forms of bullying that children can be subjected to, with also displacement due to violence and war. As a consequence of that, again, during the State of the Child World Report, UNICEF, they estimated that about 40% of all mental health disorders in children are actually secondary to anxiety and depression. And an estimated 45,800 adolescents die each year. So when you estimate that in terms of a little bit more operational understanding of how many children die from suicide each year, that's about one adolescent every 11 minutes that succumb to suicide because of the world around them. Added to the fact with the lack of support systems for infrastructure and data collection and support for mental health, there's very little budget and infrastructure that was allocated way back when, before the pandemic, for mental health. So we see that the problems before the pandemic have been there, and now let's see how this impacts COVID-19 kids. So before we go to mental health and COVID-19 disease in children, it's nice to circle back and talk about how the disease manifests in children, or how we have really fared. So generally, the kids do physically well when they get COVID, and we account for the total cases of the country about 9%, so very low incidence and a very low case fatality rate. So the case fatality rate pertains to the average number of people who succumb to a disease at a particular period of time. So it's 0.4. It's quite low for the child population. And we do account for just about 2% of all the deaths reported in the country. So again, they do well. And when they don't do well, usually these are the kids that have comorbidities, and these are the ones that require hospitalization and are likely to have severe COVID and require ICU care. So in order to make sense of the child data, we have collaborated, pediatricians have collaborated to create the Salvacion registry. And this registry is just collects data on how we manage and treat children, as well as the actual numbers that we follow. And as of September 30, 2021, there are about 1,811 reported cases. Age and sex distribution does not really vary from male to female. And when we look at the disease severity in kids, again, we see the repeated pattern that most cases are mild. So about 60% of the cases are mild. And this translates into most of the kids going home. So 80% are recovered. But ones with comorbidities, the illnesses that are listed below on the photo, are the ones that actually stay in the hospital and have the risk of severe disease and even death. Manifestation-wise, the triad of fever, cough, and colds is the most common in children. And most children present with symptoms. So about 80% of kids have these symptoms, and it's quite difficult to treat kids nowadays without suspecting COVID, because fever, cough, and colds are probably the top 3 most common symptoms that you would see in a child, whether it's COVID or not, because about 80% majority of the diseases that we treat in the children are actually respiratory. They're actually viral. So the symptoms don't actually differ from COVID. Because they're such very good carriers of the virus, and they have mild symptoms, they're actually very, very good transmitters of COVID-19. So the scenario is you have a child with very mild symptoms, but has the same viral load as adults. So while we're not really concerned about their particular condition turning sour, we are concerned about them being able to transmit the disease very fast and very well to other people. So clinical syndromes that can happen. So usually it's just the run-of-the-mill flu, the systemic viral illness, as we call it, and upper respiratory tract infection, maybe a sore throat or a cough. Long haul COVID has not been routinely reported in the child population, but we do have some patients that actually report some long-term headache or difficulties in concentration long after they have recovered from the disease. For moderate, severe, and critical conditions, we have pneumonia, which could turn severe, sepsis or bloodborne infection, acute thrombosis, which happens when there's massive inflammation and blood clots form in the blood vessels, which may block the major arteries in the heart or the lungs. And the multi-system inflammatory syndrome in children is a very rare condition, but I think needs a little bit of a closer look just so parents have a little bit more of an idea of what it is. So again, it's very rare, and it's very similar to what we call Kawasaki disease, which manifests as symptoms that attack the blood vessels of the skin. So when the virus or the immune system, when the virus gets in the body, the theory is the immune system reacts to the virus in such a way that the immune system also fights its own body. So it attacks the blood vessels, so it causes redness of the eyes, can cause sore throat, can cause inflammation in the vessels of the heart, as I said earlier, and can also cause the characteristic skin rash, which is very flat and fine, and we see it all over the abdomen and the body. So just as a precautionary measure, even if children get very mild symptoms, if and when these constellation of symptoms occur, then these kids will need hospital care and very close monitoring in order to mitigate sequelae. So treatment-wise, mostly supportive care. For severe cases, we give steroids, dexamethasone, and some treatment options that we use in adults. We do it as well, like remdesivir. Very important for treating the MIS-C or the multi-system inflammatory syndrome in children is the IVIG, which is the same treatment that we give to Kawasaki disease. Sometimes we do give convalescent plasma. Very important to note the role of vitamin D and zinc sulfate in supplementation in helping boost immunity. So during the pandemic, it's very important to also mention that children have had a very profound delay or impact in terms of delivery of the child healthcare services for them. So because everybody was busy taking care of the adults, everyone was so busy trying to help the COVID situation. During the initial stage of the pandemic, there was an abrupt halt in the delivery of the routine childcare services. And during that time, there was no health supervision and monitoring for children. The vaccinations of the children were delayed or halted. Dental care in children suffered, and anticipatory guidance, which is something that we routinely do to be able to anticipate problems at each stage of development of the child. These things weren't really being done for the kids that needed them. Sick children were displaced, so we couldn't see them anywhere. They weren't welcome in the clinic because, again, they could transmit the disease or they could get COVID themselves. So sick children would Most often, because the symptoms that they would have would be fever, cough, and colds, would most often be directed to the emergency department. And there was a shift towards teleconsultation strategies, which for some part maybe did good, but there are a lot of diseases in children that you need to use your senses for. You have to feel and observe them for a prolonged period of time, which teleconsultation is not really the best platform for. And of course, when we talk about children with comorbidities such as cancer and children who needed infusions of medicines, because the hospitals were so overwhelmed and full of COVID, these children also suffered. So apart from that, on the outside end, when they don't have the disease, these are the things that we saw that put children at a disadvantage. There were lack of opportunities for play and interaction. There was the closure of schools, so there was absolutely no education. And with no school, there was loss of routine. There was increase in increase in sedentary behavior with a decrease in physical activity. There were disrupted sleep cycles. There were decreased opportunities for connections with their friends and inability to establish meaningful relationships, because it was very difficult for everybody to adjust to being locked down at the time. Last but not the least, very important to mention the economic losses that some children felt with their family and their parents losing their jobs during this time. And very apt that the State of the Children's World Children Report of 2021 now has focused for the very first time on the problem of mental health in children. So for the most part, usually these reports will focus on malnutrition, on health and sanitation, but now because we see the pandemic has highlighted the impact of the different factors around the world on child mental health, there needed to be a closer look on the mental health of children all around the world. So delving deeper, so what was the COVID effect in terms of mental health? So they saw that stress and anxiety was increased in children during that time. There was fear of infection. There was a lot of uncertainty. There was a lot of information that they couldn't process, and challenges in adjusting to the different ways of doing things, staying indoors. And this was very difficult for children to cope with during the beginning of the pandemic. There was also a moderate increase in depressive symptoms and sadness. During the first half of the pandemic, we saw that the depression and suicide rates actually increased. However, as they adjusted through time towards the latter part of 2020 and beginning in 2021, as they adjusted, we saw the rates actually stabilize and go down to assimilate the rates that they were before. Also very important to note the grief that happens with the loss of loved ones. And this has also adversely affected the mental health of children. Behavioral problems are also increased or highlighted during the pandemic because they're cooped up in the house. You know, they're not able to express themselves. They're not able to establish meaningful relationships. So there's an increase in bottled up feelings and anger, feelings of negativity and irritability, and also highlighted symptoms of inattention, such as ADHD, and also aggravated the baseline problems that we have with autism. So the younger children, because they were not able to explore a wider range of the world around them, they were more dependent and clingy with their parents. And with adolescents, again, because they couldn't do anything else, there were a lot of conduct problems and disruptive behaviors, not doing school. And corollary to that will be substance and alcohol abuse. There is limited evidence, but in some countries, they saw that young boys and young men would turn to substance abuse and drinking to be able to escape the effects of the pandemic. So lifestyle-wise, because everybody had to stay indoors and not everybody had the space for physical activity, there was a shift towards sedentary activity, already heightening what was before. So now the kids really didn't go out. So there was less exercise, there was more screen time, and generally a lower quality of life and increased psychological distress in children. On the other hand, we should also be able to note about the positive effects in mental health that the pandemic has afforded. So in some environments, other families had made best what they could do during the pandemic. And because of the increased family time, there have been positive changes with relationships between parent and child, increased connections and conversations between siblings. And some children actually indicate that they like the break from the pressures of schools and exams during the normal period. So that was how COVID impacted children in terms of mental health. Moving forward, because COVID is here to stay and will always probably be in our midst, how do we move and continue on from this stage in the pandemic? So there needs to be, first and foremost, perspective shifts as we move towards the future, and not think of COVID as something as an if, but something as a when. So much like how influenza is very common and ubiquitous, you can get influenza, that's why we get our shots every year. We expect that COVID will probably be around, COVID-19 in particular, will be around and be a cause of disease. Now, in terms of it being a minor disease or a major disease, we have yet to see how it evolves, but given that, there needs to be an acceptance that COVID is here to stay. And because we know a little bit more about the virus, there should be a corresponding decrease in the fear and the stigma and discrimination of people that have had COVID or are manifesting signs of and symptoms of disease. So there must be a positive shift in terms of helping people access care versus discriminating people with COVID-19. So when children get the disease, very important because again, it's here to stay. They will probably get it. If and when they do get it, the most important thing for children, because generally they do well, is continuous monitoring by a health professional. While it's been a year, almost 2 years of having COVID in our midst, we know a lot more about it, but we need to continue to be a little bit more vigilant, especially in children, to be able to mitigate any serious or severe symptoms that can coexist with COVID illness. Supportive care is still the cornerstone of management. Usually, because they are well enough, we usually keep them at home. But very important, when they do have COVID and when the other household members don't have COVID, is to still try to limit transmission. So again, they're very efficient transmitters of disease, so you still need to be able to isolate them if and when they have COVID. Very important is to always have an emergency action plan when things get worse. So very important to communicate with your physician. What are the things that I should watch out for? And where do I go if and when the symptoms of my child get severe? Also very important is to obtain accurate information. So a lot of times children were able to access social media or watch the news independently, formulate their own perceptions. And without processing, these perceptions can actually increase anxiety and fear in children. So very important to be able to limit these exposures, these unsupervised exposures, if and when these cannot be avoided. We have to make sure that we process information, that we encourage questions and answer them as honestly as possible. And very important to encourage children to express what they feel when they're actually afflicted with the disease. So moving forward, we have a little bit more in our armamentarium to be able to cope with COVID in our midst. So vaccination in children has started and has been approved locally. We've begun vaccinating the last 2 weeks. And for the most part, we have not seen any side effects. Moderna and Pfizer have already declared that they are already expanding their population to include the 5 to 11 years old. So it's better, it's good news for the younger children. And what's nice about this is because if they're vaccinated, then they become they're more able to go out, and we're able to open the schools at this point in time. Very prudent to note that there are some side effects that have been reported with the vaccination of the younger child population from the 12 to 15 population. And this has been reported as myopericarditis or myocarditis, which is an inflammation of the heart muscle and the heart covering of the muscle. It's very characteristic in the sense that it presents as chest pain, usually about 2 days after the vaccination. And the reason that they associated this particular condition with vaccination is because the actual evolution of symptoms and the course of the disease is actually very similar in all the 38 reported cases that they documented. Now, should you be scared in terms of having your child vaccinated? Definitely, there is some fear for parents whenever some adverse reactions are reported. We don't know much about it. We don't know what really causes it, but very important to look at it as a benefit that outweighs the risk. So the risk of getting COVID is actually could be death. We do not know. And at this point in time, even if children do well physically, we also need to be addressing their needs developmentally, socially, and psychologically, and we need to be opening schools. So at this point in time, and because the other mitigating factors are also in place, the benefits outweighs the risk, vaccination is still advisable for children. So just nice to also note that there have been antivirals that are hovering around the corner, much like the way we use Tamiflu for influenza. So there's molnupiravir, which is a drug that's being applied for emergency use authorization by Merck. And this is nice because apart from being an oral antiviral, more importantly, it reduces the risk of hospitalization or death by 50% compared to placebo in patients even with mild disease. So you can actually take it even if you have mild symptoms. So we're waiting for this. After adult recommendations, usually child population or child recommendations follow. So maybe if and when by early next year or late next year, this will be available for treatment in children as well. Very important to also not ignore the usual strategies that we employ to reduce COVID-19 transmission at this point, because we have only started vaccinating the younger child population, 12 to 17, and we have not even begun vaccinating the children who are younger than that. So while we are in this particular stage, we are not at the same stage as other countries yet. We still need to limit transmission. Very important to follow the principles of limiting contacts of infected individuals. If we have symptoms, we have to isolate, and reducing the probability of infection per contact. And one of the most effective public practices is wearing a mask. Preventing disease is also very important. So physical disease rather, and not just for COVID. And Part of that is having a healthy diet. So eating habits are best formed as a child, and we need to be able to guide them with the proper food choices. And this contributes to an overall well-functioning immune system. Sleep is also very important and results in improved attention and behavior and decreases the overall risk of mental and physical health. So if we have adolescents that are staying too long at night watching TV, we need to be able to start helping them in terms of increasing their sleep and enhancing the quality of sleep, because this very much impacts mental and physical health. And of course, physical activity helps promote, again, mental health in terms of reducing anxiety and depression, allows you to release stress. And apart from that, physical fitness also improves cardiorespiratory capacity, improves the strength of the bones, and reduces the risk of developing other comorbid conditions. So health-wise, mental-wise, there are some strategies that we can also employ to be able to cope with mental illness. So promotion of self-awareness and knowledge. So as young children, when we're talking to them, very important to be asking them how they feel and to use words with how they feel. For adolescents, writing and journaling may be an option. For anxiety as well, very helpful are the following activities. So music helps soothe the nervous system. Again, physical activity, as we said earlier, meditation and prayer. So learning how to control the breath, to control the nervous system, and the practice of gratitude, helping kids realize and reflect on what they are grateful for the day. Social media timeout is always a good idea. So I always encourage parents, at some point in the day, just put the phone down and just connect with your child. If and when you cannot put it down, or if the child is an adolescent, you have to know how to process information and correct misconceptions. But very important is to be establishing physical connection, eye contact, when you're talking to your children. Very important to be having interactions outside of technology. And a part of that is also to find alternative things that they may enjoy. So other activities that they may enjoy, like drawing or other or dancing, other activities that they may find interesting. And corollary to that, again, is connecting with people in the home. So young children, instead of being glued to the screen, need to observe people in the world around them. Older children and adolescents need to be listening, learning how to listen, learning how to talk, expressing affection and physical affection within the family. So parents at this point in time also need to be comfortable in bringing problems to the surface. So I know a lot of parents don't like talking to their children about sad things. They want things to be positive, but sometimes the child can't help it. Sometimes they feel sad. So very important to be asking them the questions. So are you doing okay today? Or how do you feel? So it helps them identify, and again, goes back to the practice of self-reflection. Very important if you have a child that already has or is manifesting mental health problems, that you're also comfortable in asking them directly about suicide, because that particular question can actually avert the attempt or the actual occurrence of the suicide. Of course, last but not the least, safeguarding our mental health will also be part of the responsibility of the healthcare professionals. So pediatricians, adolescent medicine practitioners, actually very important. They're very engaged at this time, and they're helping our adolescents receive or achieve their maximum potential. And it is not a consult or or a practice that is limited to children who have psychological distress or mental health disorders. But it is also applicable for children who are in good mental health. So even if a child is happy and does well in school, they will still benefit from being able to get tools and strategies to be able to navigate life well. So in summary, let's ask, so are the kids, post-COVID, are they all right? So we see that the kids were spared from the devastating physical effects, but still their lives were disrupted and upheaved by the challenges brought upon the pandemic, with psychological distress very profound during the first early months of the pandemic. However, children are very resilient and they bounce back. They are a population, and I'm very blessed to be working with them as a population, because no matter what the insult is, for the most part, they have the capacity to turn things around and make things better. So asking the questions, are the kids all right? Right now, they are not all right, given that all that we have said. But in time, the kids, in my assessment, will be. So with that, I will end my talk for today. Thank you very much.
Thank you, Dr. Reyes. That was very, I'm glad you ended on an optimistic note. And that was very thorough, in fact. I mean, you covered all the bases. We do have some questions here from the audience, but I also wanted to ask you, there were some things that struck me, with your presentation, and you were talking about substance abuse and all that. I just wonder, from a practical point of view, how would children at this point get their hands on illegal substances when they're actually stuck at home?
Well, sometimes they already have it in the home. Do not know. So the reports for the substance abuse for the drugs, we've not really seen it here locally, because it's very hard to access drugs here. But the reports that were included were reports in South America, so a little bit easier to access substances there. And that's how young boys in that particular environment chose to cope with for COVID. But here, a lot of people have alcohol in the home, and maybe we're not seeing it as often. But I think maybe some of them will probably try and turn to alcohol.
And you also brought up a very good point earlier, that at the beginning of the pandemic and the lockdowns and all that, we were so concerned about older people because they were the more vulnerable population, that I think it wasn't so much that we neglected children, but we just thought we had relied on children's inner resilience to actually cope with, whatever. But I guess if we had known better, we might have been a little more sensitive to children's needs, especially since they were really totally, affected by the various lockdowns, not being able to move outside the home even. No. Yeah.
So eventually we woke up and when we started seeing the suicides attempts in the ERs, and when we started seeing developmental delays on teleconsultation, then we knew that, okay, as pediatricians or as general practitioners, general doctors, we also need to be paying attention to the needs of children. And so we focused on how to improve their quality of life in the home. So that was where we started. And now that things are opening a little bit, we're getting the adult population is vaccinated. The people that we need to protect are being protected. There's a little bit more wider berth of movement. They can now go out on open spaces, not enclosed spaces. It's also sometimes a case-to-case basis in terms of the facility allowing children, but at least there's a wider range of activities that they can do at this point.
No, that's true. We have got a lot of very good questions. Just give me a second. I'll spot. There you go. And let me just start with okay, there's some very practical ones about, I think because of travel now, domestic travel and even international travel being allowed to a certain extent. What about children in swimming pools? Are they considered safe, these public spaces?
Well,
Um,
you still need to maintain the physical distancing. So chlorine really is very effective in killing the virus. So it's not really, it doesn't travel in the water, but there's
yeah.
still air. There's still
Yeah.
space. And most of the pools are outdoors, yes. If we're talking about public pools in particular, there needs to be distancing. So I would not advise if it's a crowded pool or if it's a very heavily populated pool. But if it's an isolated sort of facility, then it can be safe. And no mixing of households. Because sometimes the cousins come and then other people come, and even though you're friends and you're mixing households, and then you increase the probability of infecting each other.
But I think there's a kind of, especially within family or clans, that you kind of assume that everybody's taking the same precautions as you are, but it
The
usually,
bubble.
yeah.
They say the
But
family bubble. So
then you heard of families, entire families suddenly getting sick, right? And they say that they haven't been out at all. So
well, the
how do
risk
you?
is lower now because most of
Yeah.
the adults are vaccinated, so that's one. But it's still not completely gone. So I would advise to still try not to mix households. If and when you're going to mix households, you have to be very clear. And I always kid my mom, you have to ask for a health declaration when people come into the home because it just makes you a little bit more aware. You have to ask yourself if you have symptoms. Do I have cough? Do I have fever? It's not really effective in detecting, but it's effective in making you reflect your own condition. So, if you want to mix households, then you do a health declaration at home and, just get every precaution that nobody is symptomatic.
But I mean, as a policy, I would like to say that for Manila House, we really request that people who come, members and their guests, have to be fully vaccinated and show proof of vaccination. I mean, it's really a public health issue, right? At this
So,
point. Okay, let me move on to the other questions. There are a lot of questions about masks. So one of the questions is masks. I think will be a fact of life for the for
quite,
some time
quite
to
a
come.
while.
Yeah. So when do you think it would be safe to not wear a mask anymore? Once, I mean, we're starting now with the younger age group, being vaccinated, children, 12 to 17, I think. So at what point could we say that, okay, maybe we can be okay without a mask?
When we
For me, it's safe,
vaccinate.
and sometimes outdoors you don't need a mask anymore, no?
It depends because if you're socially distanced, the dispersal of the aerosols are very efficient. It doesn't if it's not indoors, it will not suspend as much. So there's a
Yeah.
wider space of dispersal, hence there's less chances for that infected droplet or aerosol to go to you. When we talk about public health control, at this point, we have not reached the majority of the population as a vaccinated population because we have a lot of kids. We have a very young population. Um, so if and when you don't have the majority of the population vaccinated yet, you cannot probably uh, make make uh, not wear a mask at this point in time.
Yeah.
Second, the variants. We don't know how our vaccines perform against the variants at this time. So right now the concern is Delta, but what if it's the succeeding Lambda? Some variants of concern can come up. So it's very prudent to wait a little bit before we lift these public health care measures.
And now, children being children, once face-to-face school, I know they're trying to pilot now face-to-face school, face-to-face learning in schools, right? How do you remind children to keep their masks on? Because they play, and they, and then maybe you might have one kid in class who's like, oh well, I don't need to wear a mask or something. So they might feel some peer pressure to remove the masks. How do you drum it into them that they have to wear the masks for safety, for
Well,
their own
kids
good?
will be kids, and there will be some kids that will really not tolerate the mask. We actually advise it only for 2 years old and above, and if and when they can tolerate it. But if they really feel that they have difficulty of breathing with a mask, then it's really not advisable for them to be wearing the mask. So sometimes the children have asthma, they have a hard time wearing it, then for sure, why will we force somebody who has difficulty of breathing to wear a mask? That being said, um, I think it's at this point in time, it's teaching children as a habit. When you teach it to them as something that's standard, it's also by example, something that you do when you go out. Not touching your face or not taking off your mask when other people are around. And when they see the adults doing this, the younger children, they will just follow. That's the basic tenet. For the older children, again, it's habit. It's reminding them every time and establishing that pattern of behavior. Because when they're already used to it, then they'll just do it on their own.
And are you in a position to express your opinion on face shields? Because I know it's a little bit controversial. We're the only country that still requires face shields. And no one else in the world. I think there's one other country, India, I think in the beginning,
Yeah.
but no other countries really required it of its population as an anti-COVID measure. So do they really help?
There is some evidence that it actually increases the coverage, because when you're talking about droplets, they're big drops, and that's an added barrier for the mask. That being said, it's still the mask that makes all the difference. If you have the face shield without the mask, then you're a goner. You will still get COVID. But
Well, because of the trajectory maybe of the droplets.
yes, oh, but the face shield just adds another layer of protection, but is actually more effective when you're talking about aerosolized procedures as well. So usually hospital setting, high risk setting. Outdoor wise, I personally wear it just because it's a habit for me, and I like the extra 10 to 20% of protection that it gives me, even if it's uncomfortable. I can't wear my shades, but I'm protected, so it's okay. But in terms of it being an effective healthcare prevention policy, it's still vaccination and masks that will matter.
I agree with you, because I was actually just in Europe and nobody wears shields there, and in some places they don't even wear masks anymore, right?
Yes.
And I went thinking, of course I'm going to keep my shield on, I feel safer. And then you go there and you think, okay, this is ridiculous, no one else is wearing it.
Well, the defining factor is because most of them are vaccinated. So I was in New York as well, and people were not wearing masks. Some people were not wearing masks. Most of them still do, rather. But nobody wears a shield, because again, they have the extra layer of protection and vaccination.
Yes,
So that's what
that's
makes
my
it.
feeling as well. Yeah. Okay, let me go to the other questions here. You spoke about molnupiravir, which is the the COVID antiviral,
Yeah.
right? Um, is it already out in the market? And
No. It's under EUA. It was actually still under trial. So what they saw, they did an interim analysis. So usually when we do clinical trials, midway before you complete the actual number of subjects or participants that you want to have, you'd look at the data. And what they saw, that it already helped decrease COVID progression in 50% of the people that they gave it. So that's very strong evidence that it actually works. And just like um, putting the vaccines on a speed trail for approval, that's what they're doing for the antiviral right now. So they're applying for EUA and they're producing it.
What is the course of treatment? So is there like a number of times per day? And
Yeah, so for adults, it's just like the Tamiflu. If you're familiar with Tamiflu or oseltamivir, it's a capsule for. You take it twice a day for 5 days, and that's the regimen that they indicated. But
and
in
so
terms
far,
of, yeah,
trials, it's
yeah,
proven effective. It's been proven.
the midway results. So based on that, um, maybe they're going to make the decision if they're going to continue the study. But at this point, they're already eligible to apply the EUA.
This is by Merck, right?
Yes.
And would you have any idea of the cost of it? I mean, in the early stages of COVID, people were talking about remdesivir and you know, all sorts of other medications.
Super expensive meds.
Yeah, yeah. I mean, if you can afford it, it's great. But you know, I mean, not everyone can, right? So I don't know. Will this particular um, treatment
I don't know the
more?
exact cost, to be quite honest. I haven't been privy to that or haven't looked into that. But definitely, if you look at the delivery, it's a capsule versus the antivirals that are injected or have to be delivered in the hospital. It's easy to store. Definitely, it will be very much cheaper. Mind you, Tamiflu, oseltamivir is not cheap as well. So of course, would probably be 2,000 to 3,000 pesos, but it's so much cheaper than ordering your remdesivir and your.
Yeah, yeah. No, that's hopeful as well because I don't in the studies, local studies of COVID incidences, are there any statistics about certain like what class of people? Because obviously we know the upper classes, middle classes have better access to medicine and treatment. But what about, sort of less fortunate people without real access to healthcare? What are the COVID rates for them and their children?
Well, the rate of infection is the same because we're exposed to the same virus. But in terms of management, of course, they are at the disadvantage of getting the very expensive drugs. Government-wise, I've worked at the government hospital, and they've been very good in trying to access these drugs. We're not as fast in procuring them and ordering them. I think that's why we have limited supply, both for the private setting and the public setting. For the most part, we have been shouldering the costs for these populations, disadvantaged populations.
That's good. I mean, if it's actually quite reasonable to start with, I mean, in comparison to other treatments, then it becomes more imperative and it becomes kind of feasible to subsidize it, right, for less fortunate populations. So at least nobody gets left out. Like everybody will be able to have access to that kind of treatment, and money won't really be, such a barrier for the people that need it most, right? I mean, that's what I'm hoping because you work with PGH. And
what's nice now is everybody's been helping. We've had so much support from the private sector. The culture of just helping each other get through this is just still very strong until now. And I think it will continue for a long time to come.
Okay, let me just check the Q&A box. Is the COVID we'll have time for a couple more questions. Is the COVID vaccine the first mRNA vaccine developed? You're recommending Pfizer and Moderna for 5 to 11 years old, or there's no guidance yet?
They're expanding the clinical trial to include those younger children. So right now, the studies that have been completed have only centered on children that are 12 to 17 years old. So they initially did 16 to 18, if I'm not mistaken, and then they did 12 to 15. So that's, but in our case, since we started vaccinating late, we're doing 12 to 17 together. But they're already doubling their population and including the 5 to 11 age group in the trials, both for Moderna and Pfizer, in such a way that maybe by the end of the year or early part of next year, they will probably have recommendations as to whether we can get them to younger children.
Great. And do you think that preschool age kids will be able to go to school next year? Hopefully.
Very difficult to say. I would hope so. I think because the kids that we've started to vaccinate right now are the ones with comorbidities. But maybe as we increase the fraction of the population that gets vaccinated, then there's probably a good chance. Maybe second quarter, we'll see. A lot of the preschools have shifted to online, and I know at the beginning I was like, how do you do that? Online learning for preschool kids, but it actually helps somehow. The key thing is that it's processed and supervised. It doesn't happen on its own. So you need to have the caregiver or the mother there, and you need to have closer supervision from the teachers.
Going back to other mental health issues of children, we talked about resiliency earlier. Is there a difference in the level of resiliency depending on the age of the child? Like would 3 to 5 year olds be more resilient, teenagers less? And so they would be affected in different ways by COVID?
They're affected in different ways at every stage. So maybe in terms of harming themselves or hurting themselves, such as suicide, anxiety, and depression, that would occur at the older age group. But in the younger age group, usually you see behavioral problems as a symptom of this. Mental health problems at that age, very difficult to diagnose because you need cognitive processing to be able to actually feel and put names to emotions and to process emotions. So developmentally, they're a little bit not as prone to the mental health disorders as we know them in the adult population.
But and in your practice, because face to face hasn't really been allowed for some time, how do you? Is it kind of like an obstacle not being able to relate to your patients face to face, especially with mental health issues? Now, I mean, there are things that you have to pick up on body language or what's said, what's not said. How is it kind of virtually? How have you adjusted, and how have the kids adjusted as well?
So very important is to make sure that your tech setup is really okay. A lot of people take it for granted. They just open the laptop, but suddenly in the middle of the conversation, they don't hear or the lighting is bad. And if and when you have good connection, good lighting, you can hear each other, then that's actually, if you're talking about mental health issues, it actually helps a lot for the child. So a lot of times, these kids just need to be heard. They need to be acknowledged about how they feel and to be able to learn tools how to cope with what they're feeling. And for the most part, that will suffice. It's harder for the organic diseases, typically the abdominal pain. So those are very difficult to assess online. But mental health problems wise, if and when you've made a good setup and you have a good rapport with the child, that's good. Maybe for me, I usually schedule like after a first or second teleconsult, I will suggest a third one if they're asymptomatic in person, if I feel like I need to see them. But you can do a combination of both nowadays.
But how about the privacy issue? Because obviously when you see someone in the clinic, in your room, then you can close the door, the parent can wait outside or something. But if you're, let's say, in a home and on Zoom, how, I mean, and if you would like the parent not to be there while you talk to the child alone, how do you do that when everyone can listen in now on Zoom, right?
Definitely, that's a concern.
And,
If the parents
and
are,
if, for example, the laptop is set in a family room that everybody has access to, I mean, that's part of developing rapport and trust, right, with your patient.
then I don't think the consult can be effective because the child will filter what he or she will say, will not be comfortable. Um, and part of having good conversations with adolescents is really maintaining a um, vow of privacy if and when the things that they tell you will not hurt them, will not cause them harm.
But
So very
experience
important.
so far, have parents been cooperative in that sense?
For the adolescents that I've seen, yes, because the parents know that they need to have that conversation, and the parents themselves aren't comfortable with the discourse. So for the most part, they've been very helpful. They will leave the room. They will create a separate space and do everything that they can so that the child can express what they feel.
Okay, then a follow-up question. Okay, back to the vaccinations. Would you recommend that kids age 7 to 11 get vaccinated once IATF recommends it, or should we wait a bit more time to see if they're really safe? I mean, I'm gonna venture my own opinion here. It wouldn't be suggested by the IATF or the medical community if it's not safe, but
Yes.
doc, please weigh in.
The way we approve vaccinations is we have our own FDA. So usually the every country has the FDA that sort of collects the studies and the results of the experiments and makes their own recommendation based on their own population. But there is also parallel recommendation. So when we see that a particular vaccine is already being used in another country, maybe in Europe or in the States, and we see that it's effective, we see the safety profile, then that can also hasten the approval on our end. But for a 7 to 11 without any recommendations, or if it's a vaccination on the fly without any health professional to monitor you after vaccination with no records, that's very difficult. Because, again, we see some serious effects. There have not been deaths, there are serious effects. And the very important thing is somebody is keeping the data and monitoring the children as they're being vaccinated.
Yeah. So basically the same protocols, right? For adult or any adults that have been vaccinated to date, any comorbidities, that it's actually quite thorough. I mean, I'm sure a lot of us have been vaccinated here, but there's a whole process, right? And they monitor your vital signs and all that. So I would expect the same to be done for children.
For sure, yes. Much more so because they can't decide for themselves. So we have to be very sure that what we're giving them is safe. We assume
Yeah.
the responsibility to give it to them. So
We have time for a couple more questions. Here's one that it was mentioned that children have become more clingy during the pandemic. Do you have any suggestions for them to gain a bit more of independence?
I guess it's a function of the enclosed space and maybe the limited activities. So I would suggest trying out more activities the child can be exposed to. There are a lot of things that you can try drawing in the home that you don't need to go out for. Drawing or sculpting, things that don't require much space in order to pique the interest of the child. The reason why the child is clinging is because there's no other things that can interest him or her. So if you increase the range of the things that can possibly help him along or her along, then that would be a good strategy.
Okay, we've kept you long enough today, Doc. I think you've also got other things to do. Thanks for taking time out from your very busy schedule to address this really serious issue for us. And maybe I'd like to ask you if you have any parting words for our audience.
Very happy to share,
Right?
the status of children right now. Generally, we're doing well health-wise. We're resuming vaccinations. So what I want to encourage parents to do is to reconnect with your friendly pediatricians to resume your health monitoring and supervision because they need it. You know, we need to be able to detect problems early on to be able to manage them, whether it's physical health or mental health. So we would love to see you back in the clinics, maybe a teleconsult before that. But definitely, we need to resume childcare services already. We need to start completing vaccinations and preparing the children as the world opens up.
Thank you again on a very hopeful note. Thank you so much
Thank
for
you.
today's discussion. Thank you, Dr. Olivia Camille Reyes. And thank you everyone for joining us today. Please don't forget that this will be up on YouTube in the next 24 to 48 hours. And I think you can also still catch it on Facebook because it's being streamed on Facebook. So the recorded version will probably still be on Facebook. And for any questions or inquiries, you may contact us at Manila House at events@manilahouseinc.com. And if you want to get in touch with CMI or schedule an appointment, please visit them on www.cmi.care or visit their Facebook and Instagram page at cmi.care. So that's it for today. Thank you so much. Please stay tuned. Next week, we've got November 5. We have our Southeast Asian crawl featuring Thai food by our in-house executive chef, who is Thai, Chef Pia Suthasiri. He's going to do a demo of Pad Thai. This is in partnership with Asian Society. So thank you, CMI, for partnering with us once again today. Thank you, everyone, for joining us. And stay safe, everyone. And for those who haven't been vaccinated, please get your vaccines. And for those with children aged 12 to 17, you may now present them for their vaccines. Thanks again, and we'll see you soon. Thank you, Doctor.
Bye.
Bye. Bye, everybody. Thank you.